1. Which of the following best reflects the principle of adult learning when training pharmacy staff on California pharmacy law? A. Emphasizing memorization of statutes only. B. Using real-life pharmacy scenarios to explain legal concepts. C. Providing information without context to avoid confusion. D. Limiting training to lecture-based sessions. 2. When assessing the effectiveness of a California Pharmacy Jurisprudence training program, the most valid evaluation method is A. Asking learners if they enjoyed the session. B. Measuring changes in compliance behavior at the workplace. C. Reviewing attendance records only. D. Counting the number of questions asked during training. 3. In curriculum development for a pharmacy law training course, the first step is A. Create assessment questions. B. Establish clear learning objectives. C. Design visual presentation slides. D. Deliver a pilot training session. 4. A pharmacy intern asks a mentor about reporting requirements for controlled substance theft in California. The most effective mentoring approach is A. Give them the DEA form without explanation. B. Share a personal story of handling a similar case and guide them through the process. C. Refer them to the pharmacy's website without further input. D. Avoid answering until the intern gains more experience. 5. Which of the following is a key component of evaluating a pharmacy law curriculum? A. Measuring learner satisfaction only. B. Tracking financial outcomes from training. C. Assessing learner ability to apply legal principles in practice. D. Counting how many hours the training lasted. 6. In California, pharmacists must notify the Board of Pharmacy of a change in their address within A. 10 days, B. 30 days, C. 60 days, D. 90 days. 7. Which communication technique best ensures that an adult learner understands new regulatory procedures? A. Reading the law aloud verbatim. B. Encouraging questions and discussing real-world applications. C. Providing only written statutes. D. Using complex legal jargon to maintain accuracy. 8. When a pharmacy develops a new training module on cures, controlled substance utilization review and evaluation system, which principle of adult learning is most critical? A. Immediate application of the system to real prescription cases. B. Relying solely on lengthy policy documents. C. Excluding feedback sessions to save time. D. Avoiding interactive practice to reduce workload. 9. Under California law, a pharmacy must report drug losses to the board within how many days of discovery? A. 1 business day. B. 3 business days. C. 7 calendar days. D. 14 calendar days. 10. A pharmacist mentoring a new graduate about counseling patients on opioid safety is applying which adult learning principle? A. Passive observation. B. Rote memorization. C. Relevance and problem-centered learning. D. Punitive feedback. 11. When evaluating whether pharmacy technicians understand new HIPAA privacy requirements, the best assessment tool is A. A multiple-choice test only. B. Direct observation of their counseling interactions. C. A satisfaction survey. D. An attendance sheet. 12. California law requires community pharmacies to maintain records of dispensed controlled substances for at least A. 1 year. B. 2 years. C. 3 years. D. 5 years. 13. What is the primary purpose of conducting a needs assessment before creating a California pharmacy law training module? A. To reduce the training cost. B. To identify knowledge gaps and compliance risks. C. To meet state accreditation requirements only. D. To make training materials longer. 14. Which mentoring approach best supports a new pharmacist struggling with time management and compliance tasks? A. Giving them a handbook and leaving them alone. B. Demonstrating effective strategies and providing constructive feedback. C. Criticizing them for inefficiency. D. Avoiding involvement in their work. 15. In California, a pharmacist must report a change in employment address to the board within A. 10 days. B. 15 days. C. 20 days. D. 30 days. 16. Which adult learning principle emphasizes that learners benefit most when training is connected to their daily responsibilities? A. Readiness to learn. B. Abstract learning. C. Passive memorization. D. Rigid structure. 17. A pharmacy preceptor encourages interns to reflect on mistakes made during patient counseling. This is an example of A. Evaluation bias. B. Experiential learning. C. Memorization strategy. D. Hierarchical teaching. 18. Which California regulation requires pharmacists to provide patient-centered counseling for new prescriptions? A. Business and Professions Code, Section 4300. B. California Code of Regulations, Section 1707.2. C. DEA Title 21 CFR Part 1306. D. FDA Title 21 Part 210. 19. In evaluating the effectiveness of a pharmacy law training session, the best way to determine long-term retention is A. Review post-training surveys immediately. B. Assess on-the-job compliance behaviors after several weeks. C. Count the number of attendees who completed the training. D. Review the length of the training materials. 20. According to adult learning theory, the use of case studies in pharmacy law training is most effective because A. Adults learn best through passive listening. B. Adults prefer abstract theories over practice. C. Adults value practical, experience-based problem solving. D. Adults require minimal context to understand concepts. 21. A supervising pharmacist must report to the board when a pharmacy intern is terminated for theft. The required time frame is within ... A. 10 days. B. 15 days. C. 30 days. D. 45 days. 22. In curriculum design for California Pharmacy Jurisprudence, which step ensures that learners can apply knowledge in practice? A. Creating learning objectives. B. Selecting content sources. C. Aligning assessment with real-world scenarios. D. Preparing course evaluations. 23. A pharmacy staff member expresses confusion about new opioid dispensing limits. Which communication strategy should a mentor use? A. Repeat the statute word for word until it is memorized. B. Ask the staff member about their experiences and relate the new law to their work. C. Assign them to read the law independently without discussion. D. Test them without any prior explanation. 24. Which California agency manages the Cures database for controlled substances? A. Board of Pharmacy. B. Medical Board of California. C. Department of Justice. D. Department of Healthcare Services. 25. An effective evaluation tool for measuring whether pharmacy employees comply with California's prescription labeling requirements would be A. Role-play exercises with feedback. B. End-of-training satisfaction surveys only. C. Written reflections on the importance of labels. D. Attendance checklists. 26. California law requires pharmacies to perform a controlled substances inventory every A. 1 year. B. 2 years. C. 3 years. D. 5 years. 27. Which adult learning approach helps pharmacy staff best retain new information about drug diversion prevention? A. Group discussions using real case examples. B. Long lectures on legal statutes. C. Reading policy manuals silently. D. Testing without explanation. 28. A preceptor uses active listening and asks clarifying questions when an intern discusses challenges with record keeping. This demonstrates A. Authoritarian teaching. B. Reflective mentoring. C. Directive correction. D. Punitive discipline. 29. Which California law regulates the transfer of Schedule II controlled substance prescriptions? A. Title 16 CCR Section 1717. B. Health and Safety Code Section 11164.1. C. Business and Professions Code Section 4040. D. Title 21 CFR Part 1306.12. 30. During curriculum development for a pharmacy law review course, instructors should prioritize content that A. Focuses on memorization of drug names only. B. Relates laws to real-world pharmacy practice scenarios. C. Excludes interactive exercises to save time. D. Avoids discussion of ethical issues. 31. Which is the most effective evaluation strategy for assessing a pharmacist's mentoring effectiveness? A. Collecting anonymous peer reviews from interns. B. Direct observation of the mentee's performance with a checklist. C. Relying only on test scores. D. Measuring attendance at mentoring sessions. 32. California pharmacies must notify the board within how many days if they change their pharmacist in charge? A. 10 days. B. 15 days. C. 20 days. D. 30 days. 33. In adult learning, which teaching method is most effective for reinforcing California Board of Pharmacy disciplinary guidelines? A. Reading the code without interaction. B. Case-based group analysis of real disciplinary cases. C. Memorizing each fine amount by heart. D. Passive video watching without discussion. 34. A pharmacist mentors a new technician by gradually increasing responsibility while providing feedback. This mentoring strategy is known as A. Scaffolding. B. Role modeling. C. Microlearning. D. Peer assessment. 35. According to California law, the pharmacist in charge must complete a self-assessment form. A. Every 12 months before July 1. B. Every 2 years before July 1 of odd-numbered years. C. Every 3 years before January 1. D. Annually before December 31. 36. Which communication strategy would best ensure patient understanding of California's mandatory consultation law? A. Using plain language and confirming comprehension through teach-back. B. Providing a printed copy of the law without explanation. C. Giving a list of references to review later. D. Using only medical terminology for accuracy.